So this is called kind of a STEMI team.
We
Is that
do call it
right?
a STEMI team.
Okay, all right. So a person could come through, and maybe we should review, and I know we've talked a little bit about this, maybe some difference as far as some signs and symptoms of a heart attack versus signs and symptoms of a stroke.
Signs and symptoms usually are severe chest pain, mid-sternal. It usually can radiate down the left arm or up into the jaw. Women can experience some indigestion type symptoms, nausea, feel like they have heartburn. Would you like to?
Sure.
Any others that you look for?
And it's important to realize that it's not just one side of the body. You can have radiation to the other side. You can have radiation to the jaw, like you said. Women, especially older women, post-menopausal women who've stopped having their period, oftentimes will present with abdominal pain or just dizziness, sometimes sweating and shortness of breath. So really, there's the typical type symptoms you have with heart attack. Everybody knows the chest pain and having your fist over your chest, but really there are lots of signs and symptoms of heart attack. So when anybody comes in that's of the right demographic or the right type of person who might have a heart attack, we need to consider all of those signs and symptoms when deciding whether or not this is a patient who we might need to have the STEMI team come take care of.
Right, and then proceed from there as far as their care and what might need to be done. Now stroke, we also talked about stroke, so that is actually the clot possibly to the head that they could either have the clot or what they call the bleed, the hemorrhage. Tell us a little bit about some signs and symptoms for stroke.
Sure. These ones are a little bit more straightforward than the cardiovascular systems or the heart symptoms. The classic ones would be weakness on one side of the body or numbness on one side of the body, but also an inability to stand up or to feel like the room is spinning about you can be a sign or a symptom of a stroke. Sudden onset of double vision or feeling like there are shades being pulled down in front of your eyes can be a symptom of a stroke. Also, difficulty understanding speech or getting your speech out. These are all signs and symptoms of stroke.
Well, I think that's good to review, because if you're having or experiencing any of those, and sometimes the person that might be having them is not the one to notice it. It's all of us that have to be alerted to the care of everybody else too. So we talked about triage earlier. I want to go back to triage just a little bit. And when a person's coming through the door, I know we have the emergency department.
Yes.
There's actually something called fast track too.
Yes.
Can you address that for us?
Sure. The fast track is staffed by a mid-level provider, which is either a physician assistant or a nurse practitioner, and 1 to 2 nurses depending on the time of the day, and a tech. Those are more urgent care needs, stitches, sore throats, bronchitis, simple things that can be quick, easy in and out.
Right. That they're more, the person is not as life-threatening, is I guess the term we might use as far as the care, but hopefully we can take care of them.
Yes.
Now we also have Care First, which is not necessarily located on site, but we have that available as far as urgent care, and that's kind of, I think, the term that we're using, the fast track, the urgent care, because you're not feeling well, something's going on, and that might be a place that they could go to too on Ring Road or even in the Radcliffe area too. So that's similar to the fast track, correct?
Yes, yes, very similar.
But they would get triaged depending upon
Absolutely,
what
they would still get triaged the same way. Everyone gets an acuity level, which lets us know how severe the patient is. Say acuity level 1 is basically emergent, I need a doctor right away, down to a 5 where the patient basically, that's all they need is something very simple.
Right. Now, if someone's coming to the hospital, to the emergency department, or even actually if they're going to an emergent care situation too, what are some typical things that they should be prepared to bring with them? They
definitely need to bring their identification. I would suggest you bring all your medications, either pill bottles or a medication list. Anything that they would need for their daily livings at home, like a cane, walker, glasses, hearing aids, dentures, anything that they would probably need at home that they need there.
So, and they need to then be prepared to tell you about allergies.
Yes.
Once
the patient gets, we don't do that in triage. Once the patient actually gets into the bed, the primary nurse will see that patient, and they will get into the past medical history, surgeries, allergies, medications, ask you about your social living as far as if you smoke, you drink, and we'll go from there.
Right, because really they might be there for a specific I guess I want to say sign or a symptom, something that they're experiencing, but you're really doing a head-to-toe assessment.
Sure.
Because you have to make sure everything is working,
Right.
You know, to keep their whole well-being up and going.
Right.
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 There have been a lot of advancements as far as documentation and taking care of the patient. We've been talking about that head-to-toe assessment. Tell us a little bit more about that.
The T-system documentation that we've implemented into the ER really lets us focus in on what the patient is there for. It's an easy way for the doctors and the nurses to stay in contact with each other about what's going on with the patient as far as their assessment. If anything changes in their assessment, it also cuts down on documentation errors as far as doctors writing orders and we're not being able to read them as well. We also have a system, it's called CPOE in our T system, where the nurse can pick a certain protocol that we can go ahead and order certain labs or x-rays for that patient before the doctor actually sees them, which helps expedite their care. Say you come in for belly pain, we know exactly what we need to order as far as labs and x-rays. That way when the doctor catches up and is able to see that patient, he already has certain information there, which helps expedite the process and helps speed up the patient's care while they're in the ER. We also have an iStat system that we started using this past year, which we test cardiac enzymes with. They're at the bedside. They can be done within 10 minutes. Normally it would take up to an hour to get those results done. So within that 10 minutes we can diagnose heart attacks, congestive heart failure, electrolyte imbalances, which is really great with helping expedite care.
I was going to say, it sounds like this communication then is smooth, and that it's also really providing that attention to that patient and making sure they're getting that care as quickly as they can to get those results back, because it really is trying to you're really trying to find out what's going on, and there's so many things that have to happen at the same time, and you're waiting for those answers to come back so that you can help make sure they get the right treatment.
Yes.
So this is really, really good to get that attention to that patient that's coming through the doors. Now, also we really care for that patient while they're there, but I also know something else has been implemented called discharge follow-ups, because we want to make sure that that patient has had that opportunity to have follow-up once they have left our doors.
Yes.
At Heart and Memorial Health. Tell us a little bit about that.
We have several staff members who are now doing discharge follow-ups. Our goal is to call 100% of the patients that are discharged. We want to know how their stay was. We want to know if they were treated well. We want to know what we did right, what we've done wrong. That way we can work on getting better and work on taking care of our patients as a whole.
Well, and we also want to make sure that they've had the opportunity to get the care that they needed, the resources, obviously, for their follow-up, and making sure that they're able to comply with what was given to them, so that their treatment is, taken care of. Because sometimes you're seeing them in that state, but there's also the things that might need to happen 5-10 days out the road to make sure that they get a follow-up x-ray or a follow-up doctor's appointment, obviously, too, with their primary care physician, because really the emergency department is not a substitute for seeing your primary care physician.
Right.
You really need to make sure that you have that person, that that point person, your physician, your healthcare provider, that you're able to see on a regular basis. We're here when they need them in an emergency situation.
That's right.
Obviously.
But and I think you touched on an important point. There are always at the end of a shift a certain number of patients you feel particularly concerned about that you send home. Not everybody is appropriate for admission or observation, and these callbacks really allow us to see how these disease processes, or the chief complaints, how is the abdominal pain progressing, and things like that, and it allows us to make one more attempt to try to properly direct that patient's care, because sometimes they're coming in and they've only had abdominal pain for an hour or two and things seem to subside, and sometimes they subside and go all the way away, but sometimes things get worse, and it allows us a chance to say, okay, what's coming back, you need to come back here.
Right, because you're usually seeing them for a short span, making sure they're either taken care of and sent to their primary care physician upon discharge or whatever might need to take place, or they actually might even be admitted to the hospital. So it just depends on the situation.
Absolutely.
Absolutely. Well, we appreciate all that you have shared with us today. I think this is very important information for our viewers to understand a little bit more about what happens in the emergency department, all of the great services, the certifications, the important care that you are really providing to our community. So thank you for joining us today.
Thank you for having us.
We hope that you've had an opportunity to learn a little bit more about the emergency department services at Heartland Memorial Health, and that you tune in next month when we have another important edition of Health in the Heartland. For more information, please check out our website at www.hmh.net.